For this procedure, the hand of the damaged side is bent at the elbow joint to form an acute angle, and the palm is located in the deltoid region from the healthy side. In this position, the limbs are bandaged, and by using a roller bandage, the hand is fixed by the circular movement of the bandage from the sick arm to the healthy one. From here, a bandage is lifted along the back from the damaged deltoid area. It is bent around the rear to the front, and a bandage is dropped down to the shoulder. Next, picking up the elbow from below, and it is directed to the armpit from the healthy side. The movements are repeated several times, with each vertical stroke of a bandage medially from the previous one and each horizontal below it. Lastly, secure the bandage with the adhesive tape or hook.
Apply a cross bandage on the chest by using a gauze roller bandage. The bandage is led to the lateral surface of the back on the left, then lifted obliquely up the back, onto the left shoulder, and obliquely down the chest, ending the cycle with a circular twirl. The cycle is repeated 2 to 5 times. Lastly, the bandage is secured with a clip.
Patient's hand must be on the hip. Wrap elastic bandage around top of the bicep 2 times, creating an anchor. Pull moderately tight. Do not take the stretch out of the bandage. Wrap underneath armpit, over the top of the shoulder and across the chest, pulling tightly. Follow the wrap underneath the unaffected armpit and across the back and pull tightly over the shoulder. Loop underneath the affected armpit and over the shoulder again back across the chest. Overlap the bandage at least 1/2 width of the previous pattern. Repeat the pattern until the elastic bandage runs out. Once finished, secure the bandage using tape or hook. Make sure that it helps and reduce any type of external rotation and make sure that it feels good for her. Don't forget to check for circulation and make sure that it's not terribly tight.
Ask the person to support his arm with his other hand. Gently slide the triangular bandage underneath the arm. The point of the triangle should be underneath the elbow of the injured arm. Bring the top end of the bandage around the back of the neck. Fold the lower end of the bandage up over the forearm to make the top of the bandage out the shoulder of the injured side. Tie the two ends of the bandage together in a reef knot above their collarbone and tuck in the free ends. Adjust the sling so that it supports their arm all the way to the little finger. The edge of the bandage by the elbow is secured by twisting and tucking it in. Check the circulation in their fingertips every 10 minutes. Press their nail for 5 seconds until it turns pale, then release it to see if the color returns within 2 seconds.
So we will do a divergent bandage. Take the elastic roller bandage and then we will start at the middle. We'll start at the middle first. So make sure the hand is 90 degrees. And then we'll go up. Don't make it too tight for the patient. And then we'll go at the forearm. We will cross at the ulnar fossa. And then take the surgical tape and tape the bandage. Are you comfortable? It is not too tight, right?
Use a roller bandage to wrap around the injured hand and to secure the dressing in place. Secure the bandage by applying adhesive tape at the ends of the bandage.
Put 2 or 3 gauze pads to protect the wound. Using a roller bandage, wrap the wrist once before starting covering the one finger. After bandaging a spiral one, a finger bandage is laid along the back surface through the wrist and bandages until the next fingers are all bandaged. Always, on the left hand, begin bandage with the little finger, and on the right, begin with the thumb. Finish the bandage with a circular motion around the wrist. Lastly, secure the bandage with a tape or a hook.
Put pressure using a gauze pad onto the wound directly for protection and to ensure the bleeding stops. The casualty can help hold it in place if the casualty is able to. Then, apply a roller bandage on the forehead using a circular motion. In this video, a gauze bandage is used. Circle the head at least 3 times to keep the dressing underneath in place and secure. Lastly, cut and use adhesive tape to attach the ends of the bandage.
Let the patient be in the sitting position. The first round is superimposed with a bandage about 1 meter long in the form of a ribbon that goes through the parietal region. Then the ends are stretched and diverted under the chin. Then overlay of circular tour. Reaching the bandage is wound around it and leads to the back covering the occipital region. Then, on the opposite side, the bandage is also wound around the string and goes anteriorly, covering the frontal region. Consistently approaching behind and in front of the parietal region, the entire cranial vault is covered. Lastly, the end of the bandage is attached to the string and it is tied under the chin. Then use scissors to cut the excessive part of the string.
Using an elastic roller bandage, make a binocular type of bandage for covering the both eyes. The head of the bandage is in the right hand. Circulate go from the right to the left twice. Then, the bandage goes down to the left eye after putting the dressing, passes nose bridge, under the auricle, and then rises obliquely upward to the occipital region, passes the forehead area. Make the turn once again and then a circular on the forehead from left to the right. Then, the bandage goes down obliquely downward to the occipital region and rises to the right eye with dressing and then passing under the auricle. Lastly, do the circular around the head tightly and seal the bandage with tape.
Put a sterile gauze pad on the wound of left eye. Lay center of the first cravat over top of head with the front end falling over an injured eye. Bring second cravat around head over eyes and over loose end of first cravat. Tie in on the forehead. Bring ends of first cravat back over top of head, tying there and pulling second cravat up and away from an injured eye.
Using a roller bandage, start to make a spiral bandage to secure the dressing. Make sure the patient is lying when elevating the leg while bandaging. This is to get rid of swelling and pain faster. The bandage is started with circular bandages in 2 to 3 layers. Then, the bandage is led from the periphery to the center. In this case, the bandage tours go somewhat obliquely from the bottom upwards, and each subsequent tour closes 50% of the width of the previous one. Make sure there is no wrinkles during bandaging to prevent any extra pressure on the leg. Secure the bandage with the adhesive tape. Also check the circulation on the leg every 10 minutes.